is an emergency, a brain attack, cutting off vital blood flow and oxygen to the brain, and affects over 700,000 people each year. That's one person every 40 seconds. Today we have Brent Deerking from Northstar EMS to talk about the importance of understanding strokes. Thanks so much for being with us today, Brent.
Well, thank you very much. It's a pleasure to be here.
A lot of folks may not even realize simply what is a stroke. Would you just touch on that a little bit?
Sure. Well, stroke is normally an injury to the brain, and it's caused basically by two possible events. The first one is what we call an ischemic attack, where blood flow through the arteries of the brain are occluded in some way, which reduces blood flow to the vital areas of the brain, which can cause then injury to those specific sites that aren't receiving the oxygen that they need to be getting. The second type of cause of a stroke is what we call hemorrhagic injuries, where the blood vessels in the brain actually burst for some reason. For instance, high blood pressure may be a cause of that, or a traumatic injury to the head could cause a ruptured blood vessel to occur, which again affects blood flow and oxygenation to a certain part of the brain, which then can result in some devastating effects.
Who is at risk for a stroke? Is it anyone?
Well, you know, pretty much anyone is. Certainly those that have high risk factors for stroke, such as heart problems, being overweight or obese, diabetes, smokers. There's a lot of people who are at risk. And when you look at the demographics, typically African Americans tend to be a little bit more at risk. And some studies are suggesting that more women are at risk, but when you look at that data, it's because women typically live longer than men. So that's the reason for that.
How do you know if someone has had a stroke? Are there warning signs?
Well, there are, and I'm glad you asked that question because that's really the focus of being here today. You know, in emergency medical services, we really rely upon our friends and our families to watch out for one another. So if you're ever in a situation where you notice someone isn't acting right, then you need to raise some red flags and maybe investigate that just a little bit further. And we like to use the acronym FAST, F-A-S-T, because that really helps guide someone in trying to assess whether or not someone may be having a stroke. And the F stands for facial drooping. Typically in a stroke, you'll notice that part of the face just seems to be drooping a little bit because they lose muscle tone. And the A stands for activity. And if you notice that someone isn't able to grasp things with normal strength, or they're unable to lift one side of their arm, then that should be a clue that something might be happening. And the S stands for speech. We want to sometimes ask the patient or a family member if they can repeat something very simple, like Bobby Banks went to the beach. And if they slur their words or they're having trouble with pronunciation, it could be a sign that a brain injury is starting to occur. So if you notice those things, then the T stands for time, because time is of the essence.
Right.
And what we need to do at that point is dial 911 as quickly as possible to activate the EMS system.
All right, so if you notice anything at all along the FAST line there, call 911.
That's right. And when you dial 911, be prepared to answer a few questions. You know, the dispatchers are trained and they're true EMS professionals, and it's very important that you know the location of your emergency, so be prepared to give them the address. Also be prepared to give them your telephone number, because if you happen to become disconnected for whatever reason, they will try to contact you back immediately. And then be prepared also to tell them what it is you're seeing. And they're going to ask you a few more questions after that. Don't be dismayed, because they'll get the ambulance en route as soon as you answer where the address is. But it's important that they ask you a few additional questions, because they can give you what we call pre-arrival instructions, which is instructions on what to do prior to the EMS teams arriving.
All right, a lot of great information there. Thank you so much for being with us today. All right.